All right. Good morning, everyone. It is another fantastic Monday morning here at Healthline Markets. Thank you guys very much for being on the call. And thank you for waking up early here. Now, as a reminder, I know we're in the middle of AEP, getting ready to start open enrollment for ACA business this week, actually, on Wednesday. And we understand that you're busy. So, in case you do miss one of these calls, in case you have a client early, such as 9 o'clock or even earlier, 8:30 on a Monday. Don't cancel those appointments. Clients first. These calls are being recorded and hosted on YouTube. So feel free to link over to our YouTube channel. You could type in Health Plan Markets. You'll find us there and subscribe. Make sure that you hit the notification so that way once we upload the video, you know what's going on for the rest of the week. So with that, if you haven't done already, go over to our YouTube channel and subscribe so that way you're not missing a Monday call and you get the information quick, fast, and often. So with that, we do have a special guest this morning. I'm going to bring him on in just a little bit, Mr. Quan Green from Florida Blue, and he's going to tell you guys the latest on what's going on over there, and we'll get him rocking and rolling. But in the meantime, as we always do, we keep one foot in the classroom and the other one in the field at all times. So let's take a look at the training calendar this week. It is very light because we are in the middle of battle here for AEP. So later this afternoon at 4 o'clock, United Healthcare is doing their virtual office sessions. So if you have any questions, concerns, or any help that you might need for United Healthcare, they are an open book on at 4 o'clock today. Nothing going on tomorrow for Halloween. So be careful if you're going trick or treating out there. There's lots of ghouls and goblins, we know, right? Well, I hope you guys have fun. Be safe, be careful on Tuesday. And then Wednesday's the 1st, November 1st already. Can't believe it. But it's a busy one for the training calendar. We've got Mr. Al Clancy, who just celebrated a birthday over the weekend. So if anything, join his class on Wednesday and wish him a happy birthday. He's finally of age, so he can have an adult beverage now. So there you go. But he's available to you every Wednesday at 9:30, just in case you have any questions about the industry, you feel lost, you're not really sure where to go. Al's your guy. So he's made himself available for an hour every Wednesday morning. From 9:30 to 10:30. So jump on that session there. Cigna's doing the same thing, virtual office sessions at 11. We've got a Humana training, new agent Vantage review. This is their portal system for Humana. It hosts all your Humana and Care Plus information. So if you need a deep dive on how to use the Vantage portal system from Humana, that's going on Wednesday at noon. Also, Humana is going over their chronic plans and all the resources available for that too. And that is on Wednesday at 1 o'clock. Thursday, Ambetter is doing an open enrollment review. Those of you that are doing ACA, the window shopping is now open, so you can go out to healthcare.gov or Health Sherpa and take a look at all the plans in your area just by hitting a zip code, and you'll see the products and pricing and kind of play around with that for your clients. So some of you have already done that, and you can kind of gauge, who's going to be the heavy hitters on ACA this year. If you're in Central Florida, I can tell you Health First is going to be a beast. Ambetter is always going to be big across the country. So they're doing their training at 10:30 on Thursday. So check that out. That is an open enrollment review. They're going to go through their plan benefits and make sure that you know the ins and outs on what's going on there. And then last but certainly not least is our very own Tom Ryan, who is hosting What About HPM Shop? So this is an ongoing weekly training that starts at 9 o'clock on every Friday. And you can jump on there to get a deep dive training or just questions answered on how to use Shop specifically to search, quote, and enroll your members for Medicare Advantage, Medicare supplement plans, and the HRAs as well. So check out that training. That's this Friday at 9 o'clock. Mark your calendar. That's a training for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. If you're not attending trainings, you will be missing out, okay? Please make sure that you know that because you could miss a sale. You could miss an opportunity, just like this call today, we're going to be talking about some great stuff here. So please make sure that you are keeping tabs on what's going on out there. All right. I'm going to jump over to HPM Shop, and we've been getting a lot of questions about the Medicare eligibility, the Medicaid eligibility, and I just want to touch on that again. This is a fake profile here for Mr. Joe Dirt, and he's interested in getting some plan information from me. He was a referral, let's say, and he's coming to you for the first time. Now, I want to make something clear because there's confusion about the scope, the 48 hours, and I want to remind everybody that the 48-hour rule applies to anyone that you have consent to contact to, and you're going to call them and offer an appointment. Okay, now that appointment cannot be set more than 48 hours from the date that they sign the scope of appointment. Okay, now there's an exception to that rule. And the rule is if they call you, so let's say this person is a referral, and they call you today, you can send them the scope today, and you could talk about plans today. Okay, you don't have to wait 48 hours. It cannot be initiated by you. For instance, you collected a consent to contact, and you texted them, and then they called you. No. They have to clean call you, okay? And they reach out to you. Maybe they grab the business card at one of your tabletop events, or maybe the doctor told them to call you and they call you today. You can scope them today and you can enroll them today. Okay, you don't need to wait the 48 hours if they are calling you first. Okay. You know what? Just want to make that clear because I know everyone is kind of jammed up with this 48-hour rule. Just keep that in mind if they're reaching out to you today. Many of you had done your postcards and emails through the platform, the CRM platform, and so your members are calling you. Same rules apply, right? They're in your book of business, and if they call you and they want to get things done today, you can get that done today, okay? So with that, I want to share with you a couple things about the Medicare eligibility. Remember, you do need the MBI. This is not the social. And you could check eligibility. We have seen some errors. For instance, if the member is 3 months out or 4 months out, maybe they do have their card. It's just not showing the eligibility right away. We get that. We understand that the Medicare system doesn't always sync that same way. So you can come back, you can verify it another way as well. And then also with the Medicaid as well. Okay, so you can put in the subsidy here. So for instance, if you know that they do receive subsidy for Social Security or Medicaid, there's the MSP program. You could check the eligibility that way. If you don't know, that's fine. If you just put in the information and they pull the MBI, it should link back an LIS level here and Medicaid as well. And you could double check that Medicaid ID here as well. Okay. Now, on the Medicaid verification, I also want to remind you guys that Medicaid systems don't always sync at the same time. So, for instance, let's say you check Medicaid here with Mr. Joe Dirt, and he comes up QMB. All right. If you're doing QMB here, and then you enroll them in, let's say, a Florida Blue plan, I highly recommend running the Medicaid again with Florida Blue before you do the application. Why? Well, because Florida Blue's system may not sync the same information, and maybe that individual is an SLMB or QI1, which could potentially put them on a different plan. Or maybe they're not showing up at Medicaid at all in Florida Blue system, right? So I highly recommend that if you're going to do the enrollment in a plan, if you check Medicaid here before you enroll them into the actual plan, double check with that plan to ensure that the Medicaid level is matched, because we do know that the DSNP, LIS levels, all of that is dependent on whether or not the member is showing up at that exact time during the enrollment process. Okay, we've seen applications get denied. We've seen them bounce because hey, you told us that they had a certain level and they didn't, not in our system. Okay. So sometimes it could sync from day to day. We've noticed that it could be from week to week on the Medicaid. Just please make sure that you double check with the plan prior to doing the enrollment. John's adding here, talking about the scope here. That rule applies based off the signature date. If the SOA is done on paper and uploaded to SHOP at a later time, it's still based off the client's signature date, not the upload date. Thank you, John. So what John is referencing is 48-hour rule starts from the client's signature date, okay, not yours, not when you send it, but when they actually sign the scope of appointment, not when it's uploaded. Okay, so if they signed it today, then you wait 48 hours. Okay, thanks for that, John. Appreciate that. Now, also bouncing over to the providers as well. Remember, guys, I do recommend that you use this add preferences feature at the bottom because as you're going through and helping them select their prescriptions and their providers, the system does all the work for you. If you put in the doctors, you put in the medicines, it'll tell you what plan is going to be best for that person based on the information that you supplied. Okay. And as we talked about last week, the providers, some of these providers that are syncing data, it's really great in the way that now Connecture has agreements with certain MSOs. So we have CenterWell, we have Dedicated, ChenMed, we've got InnovaCare, which is Orlando Family Physicians, and some other ones out there. And then One Medical, which is owned by Amazon, have synced with Connecture. So when you do an application, potentially, it goes right into their system. They welcome your member. They get that information way before the health plan does, and they set the appointment, and they also lock you in as agent of record. So this is really important that you're using this feature in HPM Shop to lock in your doctors. Now, what the providers are looking for, again, number one, if you're looking for value-based care providers, these are the MSOs. It'll link that in. So once you add the provider here, it's going to ask for the actual location. And you may have several providers here, but what they're asking you to do is set as primary care provider. So some of you are adding the doctor, but you're not setting the primary care provider. We ask that you do that just to ensure that you lock it in, and that's how they're getting that information at this time. We're working on another case where even though you're putting it on the application, they should get the same information. We get that too. But for now, this is what they're asking us to do. So before you move on, if you're absolutely sure you're going to use that provider, that primary care doctor, you can come back here and just make sure that you set that PCP as you continue to go. So those are some tips and tricks to make sure that we're happy and the providers are happy and you're getting full credit for all that fun stuff that you guys do out there. So Sergio's asking, is a Medicare verification for every carrier? Does it depend if that specific carrier has that service? Great question, Sergio. And that is true. It does depend on the carrier for these verification services. So just keep that in mind. Excuse me 1 minute here. Okay. So with that, it's 9:15, and I'd like to invite our very special guest, Mr. Quan Green. Quan, are you on the line with us? You might be on.
Yes, can you hear me, sir?
There he is. How are you?
Okay, excellent. I had to actually call in because my computer audio would not work, but I could at least share my screen. So
awesome.
How you doing, Justin?
I'm doing great, man. Thank you very much for taking time this morning, and the floor is yours. So if you'd like to introduce yourself to those that don't know you yet, take it away, my friend.
You. Appreciate it. Thank you so much. Appreciate it. Thank you for having me, Justin. Nick, thank you for calling and just keeping in touch. I really appreciate it. Everybody that don't know me, my name is Quan Green. I am the broker manager for Florida Blue, and I've been here for about a year now. It's been a nice ride so far. Can everybody see my screen? I just want to
Yes,
make
sir.
sure.
Good to go.
Okay, perfect. Excellent. It's working. Usually my computer doesn't work for anything, so I'm glad it's working today. But thank
It's
you all
rocking.
for having me. Yes, thank you for having me. I got 15 minutes to get through a bunch of slides. First and foremost, like I said, my name is Quan Green. Everybody should know me. If you don't know me, let's meet up, let's talk, and let's really dive into these benefits a little bit deeper. But for the sake of this meeting, I'm going to keep it high level so that I can cover a lot of information with a little bit of time. First and foremost, I wanted to give a map of Florida. And the reason why we do this is because we're broken up into territories. My territory is from Citrus County down to Hillsborough. So I have 5 great counties. However, there are some awesome counties that I'm not in charge of, and you might be selling, let's say, in Marion County. You want to get in touch with Heidi Sierra. Or if you want to go down to Palm Beach, that's Fadden Theodore, and so forth and so on. So I wanted to put this up here so that everybody has all the broker managers across Florida. We do have a new broker manager down in the Southwest region. Her name is Stacy O'Block. She is very, very knowledgeable, and she comes highly, highly recommended. And if you work in that area, you will definitely enjoy working with her. All right, let's dive right in it. So first and foremost, we do have a couple new plans in the Hillsborough Polk area this year. We do have 2 new plans. We have a new HMO, and we have a rebranded DSNP, okay? A rebranded DSNP. So with the new HMO and the rebranded DSNP, we have a limited PCP network, so it's a tighter network than you're used to seeing with Florida Blue. So with our core plans, such as our Value PPO and our Premier HMO, those networks are extremely, extremely vast. Well, with the preferred HMO and the DSNP HMO, it's a tighter network, and it's a curated network with high-performing providers. Referrals are still required for the HMO, but we have some excellent benefits this year for these new plans. With our preferred HMO, we have a richer dental that is really, really nice. We also have some benefits that's comparable with other plans, and actually puts us on the map this year, or at least in the conversation when you're at the table. For our DSNP, it's still 0. And remember, for our DSNP plan, we accept all levels of DSNP. All right, we treat our partials like we treat our fulls. So we accept all levels, right? So it's still $0 medical services. Everything is still 0. We did invest into dental this year, OTC and food. And because of VBID, we're able to continue to keep those copays at 0. And I'll talk a little bit about that in a minute. All right, let's move on. So with that tighter network, I know everyone's thinking, well, who's in the network? Well, these are the top name MSOs. So there are some provider groups that are underneath these MSOs, but these are the 12 MSOs that we are launching this plan with. Okay, these are high-performing provider networks, and what that means is that they take care of their members, and not only take care of their members, they report back to the plan. Right, so if we got all that information, we can really take care of our members. So with our preferred HMO and our total DSNP in Hillsborough and Polk County, this is the network. Okay, we still have that big, broad network for our Premier HMO and our Value PPO. Okay, with our DSNP, you see that we have a curated network. Core is still 0. Pharmacy still 0, but we did, like I said before, we did invest into our dental, vision, OTC, and OT food. This year, we have a $6,000 benefit, okay, for our dental, for our DSNP members in Hillsborough and Polk County. We also have a $150 food card that they are that they automatically qualify for once they get on our plan. Now, for the DSNP plan in Hillsborough and Polk County, since it is rebranded, the folks that are currently on the D-SNP plan will be moved to the total plan. Okay, so they will be moved. They already been notified of their new PCP. They notified of the changes. So if they do not want the PCP that they are assigned, they can also, always choose another one that's within the network. So we do tell all of our agents, if you have any D-SNP members, please reach out to them, let them know that in Hillsborough and Polk County, the complete is now total with richer benefits. Okay. Moving on, so with our preferred HMO, we this year have a $4,000 dental allowance for our preferred HMO. All right, so it's a really, really great dental plan for this year for our preferred HMO. Vision is $300. Hearing aids, all of our hearing aids on all of our plans have now moved to copays. All right, so it's a really, really easy system to just know what you're going to be paying for each hearing aid, which makes it a lot easier. All right. Any funds that are not used, we have a flex card this year. Any funds that are not used for the current year, it doesn't roll over to the next year. Everybody knows that, these benefits are yearly benefits, right? So come 1/1, it starts the new benefits, right? So, but this year we have a flex for dental, vision, and hearing of $1,000 on our preferred HMO, okay? And that's for Hillsborough and Polk County, all right? So you can use that for dental, vision, and hearing, all right? If you see over to the right, we have a little card. It says Blue Dollars. So we have a new card this year called Blue Dollars. And this Blue Dollar card has multiple wallets, okay? Multiple wallets that the member can use for their health care, all right? This will not be their ID card, unfortunately. They will still get an ID card separately. However, everything else will be used on this Blue Dollar card, okay? Like, for instance, OTC. Some of our plans will have an OTC retail benefit, all right, where they can actually go into the store, buy their OTC with this Blue Dollar MasterCard, all right? That's one wallet. Second wallet will be a healthy food allowance, right? Some of our plans do have a healthy food allowance, and I'll be talking about that in a minute. That's another wallet. The third wallet, which every member that's a Florida Blue member can qualify for, is the Member Rewards wallet. All right. So the Member Rewards wallet, everybody can qualify. This is the wallet where if you take a certain test, you can get a certain money. So if you do complete the HRA, for instance, you get $20 and so forth and so on. So everybody can actually participate in Member Rewards, but they have to opt in. All right. It's not automatically. They have to call, opt in, and they'll be able to partake into the Member Rewards. They can earn up to $200 a year, okay, to be used on OTC, vision, or hearing. Lastly, we have the fourth wallet, which is the Flex wallet. That includes the vision, dental, and hearing. All right. And this next page is a further breakdown of the benefits. All right. So all Medicare plans can participate into the Healthy Rewards. Okay. The preferred HMO in Lake Marion and Sumter, if you sell in Lake Marion and Sumter, we do have two wallets. We have, matter of fact, we have three wallets in Lake Marion and Sumter. We have the Member Rewards, right, for the Premier HMO, Healthy Food Allowance. All right, that's because of SSBCI, and I'll talk about that in a minute. And then we also have the Flex for Lake Marion and Sumter. For Hillsborough and Polk County, we have, this is the only plan in Florida that you can use all four wallets. All right, you got the Member Rewards, we have OTC retail benefit, we have the Healthy Food Allowance, and we also have the Flex in Hillsborough and Polk County. All right, so this is the only plan that has all four wallets. All right, the D-SNP in Miami-Dade has three wallets. The D-SNP in all other counties have two wallets, which is the complete. And then the D-SNP for Hillsborough and Polk County has three wallets, and it also has the OTC retail that's included in that. So the the new preferred HMO and the new, the rebranded D-SNP have some pretty good benefits as far as the Blue Dollar card is concerned. All right, so moving forward, the Blue Dollar card, we have $100 monthly OTC allowance for our D-SNP plans, all right, whether it's the complete or the total, okay? We also have some food allowances that's connected to these cards as well, right? So with the preferred in Hillsborough and Polk, it's $100. The preferred HMO is not a D-SNP, but the preferred HMO. If you qualify for certain conditions under SSBCI, you can have a $100 food card per month, all right? The complete D-SNP, that's D-SNP everywhere else other than Hillsborough and Polk County, at $115. D-SNP for Hillsborough and Polk County is $150. So where can you use this card? Well, you can use this card. 3 stores that really jump out here: CVS, Walgreens, and Walmart. Okay, we are in negotiation with some other stores. So by hopefully by January 2024, we will be adding some big retail names to this list, such as Publix and perhaps Winn-Dixie. Okay. Moving on, I got a couple minutes. I'm timing myself, so I am staying on track. All right, so we have dental. Yes, we have dental plans this year. All right, so our dental plans are a lot easier to read this year. Right down the middle, Plan 66. This is our flagship premier plan. All right, preventive and comprehensive is covered. It tells you exactly what's in it. Now to the right, you see the allowance plans. This is the best dental that we have, right? So our preferred HMO for Hillsborough and Polk has the allowance. The D-SNP for Hillsborough and Polk, which is the total, has the allowance. So basically, they can get any services that's in the comprehensive area. They can get anyone that they may need. They have that flexibility to get it done, right? So you empower a member to take care of their needs. They like that. So hopefully we're moving to that for all the plans, but this is the first year we're offering that plan, which is really good. And then if you see the premier plan, it's still a nice dental. This year they have added actually crowns, which was not there in the past. So, they did make some major improvements on our dental. Florida Blue will not get into the implant game, but if you have any patients that need implants, give me a call. I have some suggestions. All right, got a couple minutes left. Let's run through these benefits, guys. All right, so our Hillsborough and Polk HMOs. All right, so we got 2 flagship HMOs that we'll talk about, and that's the premier and the preferred. If you see them side by side, you can see the differences right up front. Hillsborough and Polk County. The MOOPs, you see the MOOP is a huge difference in the MOOP. The preferred is $1,800. The preferred got the great benefits, right? Awesome benefits for the preferred, right? The dental $4,000 allowance, right? You have the SSBCI. If you qualify for certain conditions, you can get the $100 food card plus $1,000 flex, right? That preferred is awesome. However, you got to remember it's a curated network, so don't forget that. So whenever you're looking up the network, just make sure that provider is in the network, or you let them know that it's a tighter network, but they are high-performing, really high-quality network of doctors that's going to take care of you. Our premier plan is still our flagship plan. It's doing fairly well at this time. We have done away with PAPA for the most part. We had it on 7 plans. Now PAPA is only available on 6 plans. On our D-SNP, PAPA is actually, we have the full 60 hours still available for D-SNP. Here, for our premier plan, is 30 hours. However, you have to have a qualifying condition under SSBCI. Okay? All right. Pinellas HMO, similar to our premier HMO, that's over in Hillsborough County. So I'm just going to kind of run through this because I am really, really close. All right, so moving along, our premier plan for Hernando and Pasco, you see the plan is very similar. All right, the MOOP is nice at $2,900. All right, remember the hearing aids is the copay. OTC $135 per quarter. Everybody has transportation. Do not forget that. This plan also has Baycare, all right? Remember, we do have the Baycare doctors in the Premier Network, all right? Moving right along to our citrus. If you sell in Citrus County has added 30 hours of pop-up, okay, for qualifying conditions under SSBCI. All right, DSNPs. These are our DSNPs head-to-head. You see everything is zero. They have to put maximum amount of pocket up there per CMS. However, they will never reach it because everything is zero. All right, the difference is the $6,000 allowance for the total for Hillsborough and Polk County. All right. They also have $110 OTC allowance as opposed to $100 OTC, and the food card is $115 as opposed to $150 as opposed to $115. All right. Like I said, everybody still has the 60-hour PAPA benefit that hopefully they'll take advantage of. All right. PPOs. If you ever see this number one next to a PPO, and I got 1 minute. If you ever see this number one next to a PPO when you're looking up a specialist, just know that if the one is there, then that means they're a preferred specialist, and it's about $10 cheaper if you do not see a one. All right, that's the only difference. All right, that's the only difference. Other than that, that's what you're going to see for our specialists. The MOOPs are about the same as everybody else in the industry. All right, and then as far as our PPO, and I'm going to kind of scroll through. As far as our PPOs, matter of fact, this last one, we have a MA only PPO, okay? And this is for our vets, right? MA only PPO, $75 Part B give back, all right? That's $900 a year that they can get back, and they can take care of all these, participate in all these supplemental benefits, all right? As far as our PPO, it is a travel benefit attached to it, okay? They can travel anywhere. Go to bcbs.com, find a doctor, go to that doctor just like they would if they was in Tampa Bay, all right? Lastly, you are able to sell supplements this year, all right? If you are big on selling supplements, you can now sell them and get paid for them, all right? And that's a big thing for Florida Blue. So I wanted to thank everybody for listening to me for this last 15 minutes. I appreciate you. And go Blue. If you have any questions, please don't hesitate to reach out. Call me, email me, text me, do what you guys do. I am here for you for AEP and beyond. All right. Thank you so much.
Hey, Quan, thank you very much. That's amazing information. We really appreciate your time going through all that. For those that want to get a hold of you, they may not have your phone number. Could you go ahead and ring that out, and I'll put it in the chat for you?
Yeah. My phone number is 813-455-5953.
Perfect. I put that in the chat, and then your email, please.
Yes, Quan, QUAWN .green, like the color, at bcbsfl.com.
Awesome. I put that in the chat too. So if anyone needs to get a hold of Quan Green, there's his email and phone number in the chat. And just to kind of clarify some of the terms that you were using, SSBCI, in case you guys were wondering what that stands for, that is Special Supplemental Benefits for the Chronically Ill. And I'll say that one more time, the Special Supplemental Benefits for the Chronically Ill. This is from CMS. And what he was referencing in the benefits is if they qualify for a chronic condition, they get those SSBCI benefits that are tied to that plan. So they do have to have qualifications, which is what he was mentioning there. And then also a VBID was the other one that he had mentioned, and that is value-based insurance design. Value-based insurance design, which is those supplemental benefits that he was talking about with the flex card and the food and all that good stuff. So yeah, awesome. Thank you very much for all of that, Quan. And before we let you go, if I can keep you just for 2 minutes here, one of the biggest values that people might not know about you is you used to be on this side of the fence, on the broker side. Yes.
Correct.
And you've got a bunch of brokers on this call and are watching this later on down the road. And you see the landscape, you see, successful agents, you've seen probably everything here. What would be your recommendation? What would be your tips for brokers right now being out there? Not just Florida Blue, but like what should they
Hmm.
be doing? What would be your like, hey, if I was a broker, this is what I'd be doing right now. Just curious.
Yeah. Yeah. If I was a broker, first and foremost, every day I would not be at my house. Okay.
Yeah.
First of all, you have to get out there and make it happen. You have to introduce yourself to community partners, not only providers, but really, truly community partners, those that are helping folks in the community, Salvation Army, stuff like that. Even YMCA's. And I mean, they may sound, crazy, but they help a lot of people. So anybody that helps people, you need to be in touch with. Also, the health plans, understand each plan. Being on that side, Justin, I remember, one of our biggest selling points was, hey, I offer all the plans. Okay, you offer them, but do you know about them?
Yeah.
You understand what I'm saying? We take the certifications and we go, but we don't really know the details. So I would say put in some homework and really know the details of the plans, so that you are that fiduciary when you're in front of that member. And lastly, when you're selling the plan, don't just sell the plan that's easier for you to sell. Sometimes you got to kind of lean to a plan that's not so easy for you to sell, but is the best for the member as far as the formulary, as far as the providers. You know what I mean? So really do your homework. Get out there, let everybody know who you are. Listen, everybody knows 5 people. If those 5 people know what you do and they tell 5 other people, it just kind of goes like a wave. So really just do not keep your mouth closed about what you do. Everybody that I know knows the business that I'm in. And that's how it should be, right? That's how it should be. And even though I work for Florida Blue, like you said, I was on the broker side, and I still got the broker heart. So I still look at the whole picture, because I understand blue is not for everybody. I understand United is not for everybody, Humana or what have you. But you really want to do what's best for the customer, not what's best for you as the agent. And that's how you become a really, really good agent.
Awesome, man. That is words of wisdom right there. Thank you very, very much for sharing that.
Yes, sir.
We
Yes, sir.
we talk about that, but I'm sure you're going to move the needle here, because people are tired of hearing it from me, and
Yes.
hearing it from
Yes.
somebody fresh is always good. So yeah, thank you for that,
Yes.
Juan. That's amazing,
Hey,
amazing
Justin, if I may.
tips. hmm
Hi, good morning, everyone. This is Heidi, broker manager.
All right, Heidi.
Yeah, I was here. It's just that I was having problems with the computer as well, so I was able to log in on the phone. But I just want to say a couple of things. Want to make sure that we know that our HRA is available through Connectors for all plans except the DSNP plan. And I'm saying this because I've had several calls from HPM agents, and even though we have sent email blasts, I know everybody's running and crazy and busy, and maybe you have missed the email. So I want to make sure that everybody knows that you can do the 175 HRA through Connectors for all plans except DSNP. If you're selling a DSNP and you still want to claim the HRA, you can do so by submitting the application through the Florida Blue website, and it will be $150. So just in case you don't want to miss that extra DSNP HRA money, I just want to make sure the agents know where to go. And last thing, I just want to give a quick shout out to some HPM agents that are already on the board for Florida Blue for AEP sales. So I appreciate you, Phil Coffin, Marisa Mitchell, Liz Courtney, and Vic Crumity. And that's all for me.
Awesome.
Thank you, guys.
Awesome. Thank you, Heidi. Appreciate that very much. Yes, guys, and thank you for reminding us there of the HRAs, the DSNP not available on HPM Shop, but the other plans are. So just know that, and that's where you're getting into kind of the weeds there. So, but thank you both, Heidi and Quan. We really appreciate your time this morning. Thanks for going over. And for everyone else, we will be here next week, same time, same station. And remember, if you do have a meeting and you can't make this Monday call, we are out on YouTube, and this will be uploaded later today. And you can let your folks know, so you can keep one foot in the classroom and the other one in the field at all times, knowing what's going on out there. So thanks again to you both, and thank you to everyone that's been on the call this morning. Thank you very much.
Thank you.